All right, today we are starting a new chapter. So we are covering therapeutic modalities. Just a reminder, your notes should be handwritten. And then just making sure too that you are writing your name at the top, titling it Therapeutic Modalities Lecture Notes Part 1. We will finish the rest of the notes later this week. And then trying to think, making sure your name's on it as well. All right, so we have not covered all of the medical conditions that are related to sports medicine. This is something that I typically cover towards the end of the school year, but again, because of COVID and distance learning, we are going to learn about it right now. And then if there's still confusion, things don't make sense, obviously feel free to ask me questions. So what is a therapeutic modality? So a therapeutic modality, I'm going to go back, is basically any type of treatment device that is meant to relieve someone of could be a pain, inflammation, swelling, things like that. And so in athletic training, you might be familiar with using an ice bag. An ice bag is a therapeutic modality that we use typically for someone who has maybe immediate swelling. Maybe they are suffering from some type of pain that ice can numb it. But again, there's a bunch of different other ones which we're going to go over. But today I'm going to focus on why is it that you need to know these therapeutic modalities and how your body actually deals with the healing process. So you have two different types of injuries when it comes to kind of anything, but definitely in sports. You have your acute injuries. So these are injuries that have a sudden onset. So an acute injury would be something like rolling your ankle. When you first roll your ankle, you might see that there's sudden swelling. There could be bruising. Even a cut could be considered an acute injury. Just know that an acute injury is something that happened right in that moment or relatively recently, versus your chronic injury is a type of injury that occurs over a period of time, or it could be that you have a re-injury of a previous injury. So example could be first time you sprain your ankle, that is an acute injury. However, if you keep spraining it, then that can turn into a chronic injury. Things like tendonitis, which is inflammation of your tendon, that is something that typically doesn't occur right away. It's something that takes time for it to develop. So that's going to be a chronic injury as well. So just know your acute is something that's going to happen right away. Your chronic is something that usually takes some time for it to turn into an injury or condition. You have your three different phases of healing. So this is important to understand because depending on what phase somebody is in their healing process, your choices of what you're going to use to treat them, those modalities that you're going to use are going to vary. So like an example, somebody who just sprains their ankle, you're going to want to give them an ice pack. Somebody that just, strains a muscle, you're going to want to give them an ice pack. However, if it's been a week or two down the road, you're probably not going to recommend ice anymore. Like with that sprain or that strained muscle, you might actually start recommending heat. And that's just because they're in a different phase of healing, which I will eventually get to. All right, so you have three different phases. You have your inflammatory response phase. So this is the first phase. It's usually 0 to 4 days. And just know that the length of these are just kind of not estimates, but it's like on average. Some people can take a little bit longer in their response for that phase, and some people it might be shorter. So first one is your inflammatory response. Second phase is going to be your repair phase. And so that's, again, going to vary. Some people it could be 2 days. Some people can last as long as 6 weeks. It's also going to vary depending on how severe of an injury the person has. So if somebody has a grade 1 ankle sprain, grade 1 means it's a mild ankle sprain. Their repair phase is probably going to be shorter than someone that has a grade 3 ankle sprain, which means that their actual ligament is fully torn, if that makes any sense. So theirs could last up to 6 weeks. And then lastly, you have your remodeling phase. And so this is where, again, depending on the severity of the injury, it can last from 3 weeks all the way up to 2 years. And so you might think that's crazy that something can take that long to heal. If we're talking about a complete ligament tear, sometimes those ligaments need to have surgery. And so if you're actually surgically putting in, cadaver tissue, which might be someone else's tissue, or you're taking from a different part of your body to fill in that gap, like with an ACL injury, when it's completely torn, oftentimes they'll take either from your patellar tendon, so that tendon that's where your knee is, or they'll take it from your hamstring tendon and they'll actually reinsert it. So just know that these phases are going to vary depending on the severity of the injury. And then this is just kind of where they actually overlap a little bit. So you're not going to just have all of a sudden inflammation is going to stop and then you're going to go into this like remodeling and also healing phase. It could overlap a little bit. So you might still have some inflammation in some of these phases as well as you progress. All right, the first phase is your inflammatory response. So when you hear inflammation, oftentimes it has like a negative connotation. Inflammation is not a bad thing. I think the problem with a lot of people is they don't like any type of pain. I mean, I don't like any type of pain. And so if you have soreness or if you have like a mild injury, you're probably going to have a little bit of inflammation. And people think, oh, I just need to put ice on it because it's inflamed. That's not always true. Inflammation is your body reacting to something. It's reacting to a stress that's been placed on it. So you're actually in an inflammatory phase when your muscles are sore. And so your body actually knows how to take care of itself, but it's doing a response to kind of protect itself from further damage. So in order to get stronger, your muscles actually have to be broken down for them to get stronger. So I'm using like the soreness as an example, but you have to think too, if you have an ankle sprain, you're going to have all of that swelling. That's inflammation coming in, and it's because it's trying to kind of fight whatever is causing that damage to the tissue. So once that tissue is injured, like I mentioned, your first process of healing is going to be that inflammatory response. And so this actually begins immediately. So if you look at this little not cartoon, but this image, you will see that, okay, with this cut, there's an opening. You have now vasodilation. So that's where you get all of that swelling. Your blood vessels start to open up. And because of that, you have all of these different cells coming in. They're trying to basically fight. You know, it could be infection that could be a culprit. It could be a lot of other things, but that's where you get all that swelling. The blood cells are starting to come out, that sort of thing. When you're in the inflammatory response, you might see these 5 signs of inflammation. So ways that you can tell if somebody is inflamed or something is inflamed is that there's going to be heat. So it'll be warm to the touch. There will be redness typically. You're probably used to seeing maybe some type of swelling. The person's most likely going to have pain. And then the loss of function could be due to maybe the swelling, or it could be due to the pain. So you might ask the person if they sprain their ankle, can you walk? And they might not be able to put weight on their ankle, and that's just due to the pain. Or maybe they can't really move their foot correctly to walk, and that could be due to the swelling. So again, those are just some of the signs of inflammation. And then when you first injure yourself, your body goes into a vasoconstriction mode, and then it eventually vasodilates. And it's relatively quickly. That's where I was kind of talking about. If you went back to that picture or that little image, you'll see in it that it shows at first you have let me wait till it gets to it. But at first you have vasoconstriction, and then eventually you have that vasodilation where all of the blood is actually flowing into the injury. And so because of that, again, your body is trying to protect itself, but sometimes it can overprotect itself. And then you have too much bleeding. That's where you might see a ton of bruising, a ton of swelling, and so forth. So this is where if somebody has an acute injury, you want to make sure that you're treating it relatively quickly so that it doesn't turn into chronic inflammation. Chronic inflammation is when basically that first injury or whatever is causing that inflammation, whatever that trigger is, doesn't get, eliminated, or it doesn't get treated correctly. And then that person suffers from swelling, they might have that pain for long periods of time. So again, if somebody has an ankle injury, it's super important to get them to wear maybe an ACE wrap so that that swelling can then get pushed back up into their lymphatic system. That's where you want to put the ice on it so that they don't have too much pooling of the, blood and other types of metabolites that are, keeping it down in their ankle. That's where you want to get them to start trying to kind of put some range of motion into that body part. So again, it doesn't turn into this chronic inflammation, and then that can turn into a longer term injury. Second phase, you have your repair phase. So this is where you actually are starting to get, some type of scar tissue development. The tissue itself is, changing shape, and it's starting to try to turn itself into more normal tissue. So at this point, you're not really having swelling coming in, you're not really having bleeding, because you're actually developing a blood clot, and then it eventually scabs, and then it can turn into scar tissue, and then hopefully that scar tissue starts to develop enough to where it's not too different from its previous tissue type. And again, ligament tissue is different than tendon tissue. Tendon tissue is different than your actual skin. Muscle tissue is different than all of those as well. So during this period of time, hopefully your inflammatory response subsides. Again, some people they might have a little bit of overlap, so they might have some inflammation in this phase, but it shouldn't be too severe. If it's really severe, then that means you need to backtrack, treat them for that inflammation before you progress them further along. And so patient may still indicate tenderness. So there's going to probably be a little bit of pain. And that's where you just want to make sure that you're communicating with your patient. And even if maybe this is yourself down the road, that you're listening to your body. You know, mild pain, I always tell when someone's injured and I'm letting them kind of return to play, is mild pain is probably going to be expected, but if it is really painful or you're unable to actually do whatever it is that like the full function of what you should be doing, then you're more likely, one, to injure yourself again, and two, that's not going to help you with your healing process. So it's really important for you to tell your patient to listen to their body. And again, if you're using this for your own personal treatment down the road, listen to your body. And then eventually you'll have a scar forming. So I always also mention to people, if it's a cut on your skin, then yeah, you're going to probably develop some type of scar tissue. But I also mention to people that have like torn a ligament or even a muscle or a tendon, that you have to think of what's going on the inside of your body is kind of similar to what happens on the outside. So if you were to tear a ligament or you were to tear, a tendon, eventually your body's going to develop scar tissue over those two tissues. And you have to remember, it kind of is the same to how if you were to cut yourself on your hand and you develop a scar, that tissue doesn't look exactly the same as the skin that it was there before you were cut. Same thing happens to the tissue inside of yourself. So you have to remember, when you're tearing tissue, it doesn't grow back the same way. It's not as strong as it was before. So that's why it's important to make sure that you're teaching people to listen to their body, because the likelihood of them re-injuring it is now higher, which is kind of unfortunate, but it's just the reality of how our body functions. And then the very last phase is going to be your remodeling phase. So this, again, is going to vary. Some people it might take, a couple weeks, and some people might take up to 2 years. So it's a longer term process. It's going to vary depending on the type of injury. It's also going to vary depending on if the person actually listens to the advice of either their athletic trainer, physical therapist, physician, orthopedic surgeon, whoever it is that they're working with. But yeah, it's important to listen to your body, because you don't want something that could maybe have a 6-month recovery now turn into a year recovery or 2-year recovery. But in this phase, those collagen fibers that are creating that scar tissue are now binding a little bit tighter. This is increasing then that strength of the scar tissue, so that you're actually able to function a little bit better. It's, mimicking more of what the tissue was like before, but again, it's never going to be the same as what the tissue was previously. So, example, we haven't talked about it too much, but normally I teach about all the different, body parts, injuries that can happen, and so forth. ACL, your ACL is a ligament in your knee. When someone completely tears their ACL, oftentimes doctors will recommend that they have corrective surgery. So again, they're taking tendon from their knee, or they're taking tendons from their hamstring, and they're actually putting it in there in place of their ACL, because if their ACL were to grow back together, it's such an important ligament for stability in the knee, that if it grew back together, it's not that, scar tissue that's developed is going to be so weak that the likelihood of them re-tearing it again is going to happen. So they'd rather you put in a whole piece of tissue from another part of your body that's not torn. And so you have a stronger, mimicked tendon, I guess, or ligament. But yeah, the tissue eventually resumes more normal appearance. So it's kind of, like I said, similar to how if you have a scar on your skin, you'll notice that in the beginning, it is obviously much more noticeable, but then as time passes by, as your body starts to repair itself more, remodels itself, that scar is not going to be as noticeable. So it's the same thing, similar on the inside, but again, if it's a severe tear, just know that's why they recommend a lot of surgeries for things like that. So again, by the end of about 3 weeks, you should have a stronger, firmer scar. But again, the healing is going to vary depending on the type of injury. Usually it takes a couple of years for it to totally be complete. And so, like I mentioned, you have 3 different healing phases, but just know that the process is a continuum. So what that means is somebody could, one, overlap, which I've talked about, but you can also have people who maybe are making it into the remodeling phase, which is, one of the later phases, and then something happens, maybe they tweak it, then they're going to go back to that very first inflammatory response. So again, that's why it's important to take things slowly, listen to your body. With athletic training, though, we do also recommend that you don't, favor it too much, so you don't baby it too much. But you try to be as safe and as aggressive as possible, because you don't want to, again, re-injure it and then have to go back a step. And again, you don't want to stay in the last phase for like 2 years like some people do. And yeah, as an athletic trainer, it's just kind of my job to observe if I think that somebody is progressing too quickly, to then maybe tell them, okay, you need to come back a little bit so that they don't have the risk of re-injuring themselves as well. For this, if you have any questions, feel free to just, let me know tomorrow. We'll talk a little bit about this tomorrow. Again, this chapter might not make sense right now. We will eventually, go into the different body parts and the injuries that are associated with this, but this kind of gives you just an idea of how your body responds to the different conditions, and so forth. So anyways, make sure you're turning your notes by the end of the period, and I will see you guys tomorrow. Have a good day.